Hi guys, welcome to Extremely Easy Medicine, where we learn topics and make things easy for ourselves in medical school and beyond. Today we are going to be talking about kidney tumors, something very important for us to ace our exams. Let's dive right into it. Kidney tumors span a range of benign and malignant growth. The most clinically significant is renal cell carcinoma or RCC. It accounts for about 85% of all renal cell cancers. Other less common types include urothelial carcinoma of the renal pelvis, and we also have angiomyolipoma. So basically, those are the most common ones. Now, it's important for us to remember that early detection plays a crucial role in improving outcomes. To classify kidney tumors, remember the mnemonic CRAB. CRAB, CRAB. The C stands for clear cell carcinoma, which is the most common, making up 70% of RCCs. The R stands for renal cell carcinoma or renal pelvic carcinoma. The A stands for angiomyolipoma, which is not so common but is also aggressive. And the B stands for benign duct carcinoma. Now we are going to be moving on to the clinical features. How does these tumors present clinically? We are going to be using the mnemonic TEL. I'm giving a lot of mnemonics so that we can remember it subsequently. So today we are using the mnemonic TEL for this. T stands for tumor mass or flank pain. It's usually seen in late stages. We have E, which stands for erythrocytosis. Erythrocytosis is caused by paraneoplastic secretion of erythropoietin. So E stands for erythrocytosis. We have L, which stands for loin pain. Is due to mass effect or hemorrhage or bleeding into internal organs or internal crevices. Now we can call that. Some people might also mix it up with PID or something related. Then we have lethargy. Lethargy, it represents systemic symptoms. The patient might present with weight loss, fever, fatigue, etc. Now we are going to be moving on to the diagnosis. Now, for the diagnosis, we have to follow this systemic approach. The first one is a history and examination. Just like we all know, whenever you see a patient, you have to first take a detailed history and examine the patient. In this patient, you're going to look for the classic triad. There has to be hematuria, there has to be flank pain, and there has to be a palpable mass. Although this occurs in only 10% of cases. Now you're also going to assess for systemic symptoms like fever or weight loss. Then the next step is imaging. First of all, we can do ultrasound. The reason why we do ultrasound is because it's for initial screening. Then we can move on to CT. CT is going to help us differentiate between the type of masses. It's also the gold standard, basically. Then we can also use an MRI. I didn't put it here because, well, an MRI is not commonly used. We can use an MRI if the case is complex or if you want to avoid radiation exposure. A third step is to go through to do a laboratory test. Remember, this is a kidney tumor, so we have to do a laboratory test. First test is going to be urinalysis. How do you say kidney without testing the urine? So first of all, you're going to check for hematuria via the urinalysis. Then you're also going to do a blood test where you're going to check for elevated creatinine, or you're going to check for anemia or polycythemia. Then you're also going to do a biopsy for uncertain cases. Next up, we move to the treatment. The treatment option, we have the mnemonic SNAP. So basically, just imagine snap the duct or snap the tumor, whichever one. Now, the first one is the S. The S stands for surgery. Now, the main surgery is the mainstay of the treatment for this case, and it is called a nephrectomy. A nephrectomy can be divided into two types. We have partial and radical nephrectomy. Partial nephrectomy is when there is idealized or localized tumors, and it's when you want to preserve the kidney function. Radical nephrectomy is used for large or advanced tumors. Then we have N. N is for non-surgical options like cryotherapy, radiofrequencies, ablative therapy in general. Then we have the third one, which is advanced disease treatment. Advanced disease treatment, we have targeted therapies whereby the patient uses tyrosine kinase inhibitors like sunitinib, yes, sunitinib, except like example, and we have immunotherapy whereby the patient uses checkpoint inhibitors like nivolumab, yes, nivolumab, something like that, yes. Then P is palliative care. Palliative care is to manage the symptoms in terminal cases. Now, as an accessory, what I'm going to do is we are going to discuss the difference between renal cell carcinoma and urothelial carcinoma. Now, before I do that, I want to reiterate that for benign tumors like angiomyolipomas, you have to monitor small asymptomatic cases. Larger or symptomatic tumors, especially those that are over 4 centimeters, might require you to embolize or do a surgery. Now, hereditary symptoms like von Hippel-Lindau is going to come with a lot of renal cell carcinomas. Remember that hereditary symptoms, renal cell carcinomas. So now let's move on to our quick comparison of RCC versus urothelial carcinomas. Number one, RCC originates from the renal parenchyma, while urothelial carcinoma originates from the renal pelvis. I'm going to go back so that we can see the names and not forget it. So RCC from renal parenchyma, urothelial is from renal pelvis. The next one, RCC often presents with hematuria and flank mass, while urothelial carcinoma presents with painless hematuria. RCC, hematuria, flank mass, urothelial is painless hematuria. Imaging reveals a solid mass in RCC, while in urothelial it shows a filling defect. So imaging reveals a solid mass in RCC, and in urothelial it shows a filling defect on the urothelium. Solid mass versus filling defect in urothelium. The last one, the treatment for RCC involves surgery with or without systemic therapy. Surgery with or without systemic therapy, while urothelial will usually involve surgery plus chemotherapy. Surgery plus chemotherapy. So that's it, guys. Thank you for joining us. Don't forget to like, subscribe, and hit the notification bell to stay updated on more medical topics designed to make your studies easier. If you are looking for these scripts, I'm going to be uploading it and linking the site to the channel, to this video. Ensure that you can download the YouTube script just to remember. It will help you with revision. Thanks for watching and see you in the next video. Bye, guys.